Hello guys, thanks again for watching the series. So today I'm going to start a second part of the series. I'm not going to focus just in business. I'm trying to look at this in a broader perspective and look in different dimensions of this crisis. Today I'm going to cover the history of epidemics. In order to do that, I have with me Magda. She's a medical doctor. She did her medical school in Strasbourg, France, her MBA in Yese, and she has a PhD in health policy in London School of Hygiene. She also teaches in Yezi and an elective course and also in different settings around the world. Thanks for being here, Magda, with me.
It's a pleasure, Julio. Thank you.
Perfect. I'm going to remove Magda for a moment and then I'll bring her back in the questions. So in order to start, just making some words a little bit more clear because we're probably going to use them during the way. So endemic is a disease that is common for a certain area that you have a steady state of cases every year. If you have something that's a little bit unexpected and kind of new, this is called an outbreak. And once it's starting spreading in different regions, it is an epidemic, as we saw in the beginning of this. And then what we see now is basically a pandemic in which it spreads globally to other countries in the world. So putting that aside, the way I'm going to do this, I'm going to pick some important epidemics that we had in history. In order to start, I'm going to go with probably the oldest one that we have any registry about. This is actually very interesting, started in China. The reason why the historians believe this it was an epidemic is because in that specific village, they know that the methods for them to bury people were actually very different from a house that they found 100 different people from different ages that they were burned down. So they believe that this happened because there was an epidemic in that time, and there was like a lot of people died in a short amount of time, and didn't have time enough in order to bury those people. So this would be the first registry. With DNA tracing, they're not sure what kind of disease it was that happened this. The second one, I'm gonna go over some 1,000 years. Going to the Athens Peg, we actually started in northeast of Africa and then went all up until Greece. Here, basically, the way I'm going to do this is basically I'm going to separate the fixed elements, which are the context of the disease before, and then the actionable elements, which are how people behaved and societies changed based on this. So for here, it was basically going on a war between Athens and Sparta. We're going to see that wars is actually very common to bring this kind of diseases. There was a massive migration from the countryside to the cities. This disease was described in Thucydides' book. It's believed nowadays have been typhoid fever or Ebola. Here, the interesting things is that they started burning the bodies because there was not time enough to bury them properly. And also they recognized that people taking care of the sick ones, they were more likely to get infected. And because of this, the ones that recovered, they started using them as the caretakers because there was less likely to be infected again. And here, because of the amount of people who died, basically what happened was that the wealth of the rich people started being divided to their families and other people who had access to their land. Going on, we go to the Black Plague, which is pretty famous. As you might know, it was spread north of Africa, Europe, and Asia. Here, the interesting elements are then probably it came from Asia and started to spread, especially during the cities. The disease is bubonic fever that you already know. It is expected or it's believed that actually close to half of the population of Europe was decimated with this disease. And on the actionable elements, we have that they basically closed the city to foreigners in order to contain the disease, which is very similar to what we're seeing these days. And also there was persecution of minority groups. So for example, the Jews, they were believed to be polluting the water and causing the disease, so they were persecuted at this time. The changes in society were basically that because of labor shortage, as so many people died, the average wages increased, and also there was like easier access to food and land at this time. Also in medicine, they started giving more focus to anatomical investigation. Going on to Spanish flu, which is also very mentioned in the media these last days. This was interesting because it also occurred during a war, as I mentioned before. So malnourishment, overcrowded hospitals, they frequently might bring a good environment for these things to happen. Interesting, influenza was actually much more deathly to the young the older ones, probably because there was an outbreak of the the same disease some decades before. And here the elements are there. We know that this disease is probably didn't start in Spain, but it was first reported because of other countries they were during war. And we know that they started using masks, they started building field hospitals, and also there was a underreported cases in the start of the disease. And here it's interesting to say that the changes in society are pretty relevant, as for example, women starting participating more in nursing activities in the labor force, and also they started the first deep studies on how those things were transmitted. Going on for the SARS, which is very similar to what we're seeing nowadays, probably in a smaller dimension. So what we see is that basically the first case was reported in China, and then it's a SARS syndrome and also a type of coronavirus, so very similar to what we have nowadays. It's believed that one of the reasons why that spread so much was because the reports to media and World Health Organization took too long. And also the way that they fought this were very similar, like a smaller dimension of what we're seeing right now. Economic relief packages, they created specific hospitals to treat people, and also this shed light of the deficiencies of the health system in some of the countries that happened this, especially in Asia. And now I get to COVID-19, which you probably already know pretty well the information. So basically, human mobility at rates never seen before, and also huge population living in larger cities were some of the drivers that contributed for this to happen right now. The number of deaths is still ongoing, unfortunately. The contention measures are all on the go. It's basically the countries are closed, also cities in quarantine or lockdown, strong measures of social distancing. And here the changes, maybe the changes are very interesting, as we're seeing the use of technology to trace human contact. We're seeing the largest stimulus package economically that we ever seen on history. And also that people are starting to transit to work from home jobs. And this might be a trend that stays after this is over. So with this said, I'm gonna bring back Magda Rosa-Müller in order to answer to me some of the questions. So when for the first one, Magda, after this, what are the main learnings that you believe we can get from all these pandemics in history?
Thanks a lot, Tulio. You did a great job on doing this review, because that's important for us to see, well, that happened before. We had pandemics before. Quick note on the difference to SARS. This virus is very infectious, and it can infect before we have symptoms. And that led that we could not contain it, even so we have everything in place. No, we have very good surveillance systems, the CDC in the US, the ECDC in Europe. China has learned a lot from the SARS virus and has set up very good surveillance system, but it did not work. It cannot happen here. And I think this innocence, I would say, is one of the main learnings.
Correct. And what are the lessons that you believe that all of those epidemics taught us that might help us to fight COVID nowadays?
Yes, so I think there's a lot of learning. There are a lot of things that have been done during the Spanish flu, particularly. Even so, today the bird population is much bigger, and the impact. If we look at the number, the very interesting TED talk that Bill Gates did. He did a simulation of what would happen today if we would have the Spanish flu. So that would be bigger. But what we learn is that containment measures work. That has been working very well. Some of the cities in the US have been reacting very quickly, put very strong confinement measures. They closed schools. Easy at that time, the workforce, you mentioned that, and the female workforce was not that active, and those working in the health sector were mainly nuns. So it was easier at that time to close schools, but that really worked. What did not work, or what is similar in terms of not learning, is these trying to hide the truth, and that it led to the outbreak or the devastating impact that the Spanish flu had, particularly in Europe, that it was during the World War, and that nobody wanted to report on it. And it's called Spanish flu because Spain was not part of the World War; it was neutral and could report on that. So maybe if you let me, just a very small detail that is interesting in terms of parallels is that so the leading would be the leading people people, the politician, who had been hiding that during the for the Spanish flu, the same happened now, and they got infected of it. So we get many of the leaders during the Spanish flu were actually in Europe were infected, and we have seen this with the sad case also of Boris Johnson in the UK.
Yeah. For sure, some lessons were not totally learned, right? Going to the next question. So especially after World War II, we saw that different societies, they developed different type of health systems. Europe is very well known for their public system, as US, for example, is very well known for their private system. And those two models are very different. So how do you believe like this, analyzing the crisis right now and how these two different societies are fighting the problem, how can we compare these two situations and what would be better maybe?
Well, I think a crisis like this, a pandemic like this, is a public issue, is a public health issue. We have seen that suddenly their legal disposition would be being putting in place that we would have never thought, no? That the borders are being closed, that we are confined here in Spain, we cannot go outside. And this is against our basic civil rights. So it is a real public issue. In terms of the health systems, usually if I have a public health system, it's easier in such a crisis to have a centralized approach to that. But we can see countries like Germany who did have a lot of very good preparedness at the local level, at the regional level, that worked very well in playing together between what is local and what is public. So what is at central level and what is decentralized. Private system is very difficult because the incentives are not here. Actually, in Germany, for example, the private clinics are actually suffering because they were asked by the politician to free bed capacity, and particularly intensive care capacity, and these beds are empty now as it did not develop in their region and in that way. So definitely, I would say, yeah, we need a very strong public system here for surveillance and also for the actions that need to be taken based on the information that we get.
Correct. Perfect. Going on, like some analysts basically said that the reason why some Asian countries were more successful fighting this disease was because they were already shaped because of the SARS that occurred recently and also other pandemics that they had. So do you agree with that? Do you believe, and how more prepared they are based on what they have already lived?
But you might refer to this more obedience that we might see in Asian country, that what is said in public, we actually follow. Yes, probably this is a cultural issue also, that they see that this is what is needed to be done, and we will actually follow that. Here in the European countries or in the world, what we could call the more Western world, it is more by convincing. And I think what in Europe convinced people were the pictures that we have seen from Italy, that really people saw this is really serious, and now we actually agree to follow the confinement rules. In Asian countries, it's probably more this top-down ruling.
Yeah, and it's interesting that some countries realized pretty fast that they had to do something, and they started soon, while others were still like fighting against the specialists, let's say. Going for the last question. So looking now a little bit on the future. So what are the changes or in society that you believe they're going to stay after this crisis is over for us?
Yeah, well, this is the big question, is like the world will be another world. I mean, for all of us, this is very unique. I don't think any of us has seen a crisis like this and in this dimension. So there would surely be a lot of impact. In terms of, I would say, what we could say for the health sector, the most important will be preparedness. Like until now, we had said, okay, yeah, we will actually do prepare. You see, from a managerial point of view, well, you have to have overcapacity. You know, you have big stocks of things that you have to renew from time to time. So it's a real managerial issue to be prepared in terms of how many ICU beds do we have. It's a very expensive also, no? To maintain ICU beds, you might not need in normal times. But I think where we will learn a lot will be in how can we upgrade the system to a bigger volume in terms of prices. The experts say that probably it's not the last pandemic. We all think about a second wave that might be even worse, as it was the case with the Spanish flu. So definitely in terms of preparedness for the bed capacity, but also for the production of masks, for example, and material that is needed in terms of crisis. One important point I would like to make, and I hope that we will learn from that, is at the European level. I thought that the European Union and the Commission, they're very, also actually the WHO, they're very good in surveillance, in bringing statistics together, in having this system that it's coordinated by the European Commission or the European countries, as one example, the WHO being very good at surveillance, but they were not good at action. They were not good in saying, well, now we have to act upon that and we really have to do something. So I think here I would love to have some learning that how, particularly in the European Union, we can define ways how we can put action plans in place very, very, very quickly, so as to be better prepared and better deal with an outbreak, and maybe containing it earlier than we were able to do this time.
Perfect. That's very interesting. I hope that with all so much information available, countries are able to look at which kind of policies are working and they implement it very soon. So some years from now, we can look back and say, oh, so these things really were implemented and they really worked really well. Magda, thanks a lot for being here with me.
This was a pleasure.
I really appreciate
thank you very
that.
much, Julia, for organizing these series. I think they're very good, and I think management can make a big difference here. Thanks a lot.
Perfect. Thank you.
Thank
you for watching. Bye-bye.
Thanks.